Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video I'm going to be talking about special phlebotomy collections. Alright, let's get started. After listening to this presentation, you'll be able to do the following. You'll be able to explain the importance of various priorities surrounding test collection, be able to define a fasting specimen as well as name tests that are affected when a patient does not properly fast, list reasons for requesting timed specimens, explain the requirements for oral glucose tolerance testing, and discuss diurnal variation of blood constituents, and also list the substances that are affected by diurnal variation. You'll be able to differentiate between a trough and peak level and understand the importance of collecting these specimens at the prescribed time. Discuss the timing sequences for blood culture collections. You'll also be able to describe the aseptic technique required when collecting blood culture specimens. Discuss blood collection from venous access devices and describe the procedure for collecting specimens for cold agglutinins and cryoglobulins. Again, after listening to this presentation, you'll be able to list the tests that must be chilled immediately after collection, as well as their transport requirements. List the tests that are affected by exposure to light. You will be able to define chain of custody and describe the criteria for the collection and processing of samples that are requested for forensic studies. You'll also be able to list the tubes that are frequently used for the collection of molecular diagnostic studies and describe the conditions in pediatric and geriatric patient populations, and of course how those conditions can affect the collection of blood. In addition to the learning objectives, there are also several key terms associated with this lecture. These are aerobic, anaerobic, aseptic, bacteremia, central venous catheter, chain of custody, diurnal variation, fasting, forensic, geriatric, hyper and hypoglycemia, peak level, postprandial, septicemia, trough level, and vascular access device. So now that we've discussed the learning objectives and key terms for this lecture, let's get started. So certain laboratory tests require methods that are not part of the routine venipuncture procedures. So these special methods may involve the preparation of a patient, a special timing of the specimen collection, other blood collection methods, and special handling of the specimen. Each blood order will have a priority ordered with it. The priority classifications are routine, ASAP, stat, and timed. Specimens ordered as routine have the least priority. So these are specimens that are collected on morning rounds for patients who are staying in the hospitals, or also whenever a patient shows up in an outpatient phlebotomy station to get their blood drawn. Any test ordered with the priority of ASAP, or as soon as possible, is of course collected as soon as possible, but before an order that is ordered as routine. A stat order has the highest priority and is usually for emergencies. Samples from the emergency department usually are all done stat. Once collected, a stat sample must go directly to the laboratory for testing. Now, a timed sample must be collected at the specific time ordered and would be collected before an ASAP or routine sample. Collecting time specimens incorrectly, so collecting them at a different time than when they are ordered, can cause a result in a false elevation or decreased result. So some tests also require fasting. So in these cases, the phlebotomist must ask the patient if they have been fasting. And the patient is normally in the basal state in the morning when the patient has been fasting 8 to 12 hours. So if the patient indicates that they are not fasting, the phlebotomist must put this in the record. Now, the turnaround time, or TAT, means how long it takes to complete the collection once ordered for a phlebotomist, or how long it takes to complete testing once a lab technician receives the sample. The lab must complete stat tests within 1 hour of receiving the sample, and ASAP tests generally require a 2-hour turnaround time. So I mentioned on the last slide about fasting. So if a test is ordered as fasting required, then the patient should not eat or drink except water for 8 to 12 hours prior to the collection. So examples of some tests that require fasting are glucose and lipid panels. So if the test is ordered as fasting and the patient has not been fasting, this of course will cause inaccurate results. So it's very important that the phlebotomist ask the patient if they have been fasting. And again, if they haven't been, this needs to be documented. There's also another designation called NPO for patients, and this means that they are not allowed to have anything by mouth, meaning food and water. So time specimens are those that are ordered to be drawn at a specific time. So this is not a suggested time, this is a required time. And reasons for this may be that the time draw is timed around patients taking a certain medication or drinking a glucose drink for testing purposes. The phlebotomist must adhere to this time and must write the time that the sample was drawn on the label. Diabetes mellitus is a group of diseases that affect how the body uses blood sugar or glucose. Glucose testing is done frequently in laboratories to help diagnose diabetes mellitus and also to monitor patients that have it. So the glucose tolerance test is one of the most common time tests for patients in the outpatient setting and is used to determine if a patient has either diabetes mellitus or gestational diabetes. And gestational diabetes is when diabetes is first diagnosed in pregnancy. So oral glucose tolerance tests are used to help diagnose those patients, and the American Diabetes Association recommends a 2-hour oral glucose tolerance test for diabetes mellitus diagnosis and a 1- and 2-step oral glucose tolerance test for gestational diabetes diagnosis. Now the 2-hour postprandial glucose test means that the patient eats a meal and then blood is drawn 2 hours post-meal. So the next slide we'll talk about these individual tests. So an oral glucose tolerance test is scheduled ahead of time. So the patient is given instructions to eat a balanced diet with carbohydrates for 3 days prior to the testing. The patient will then fast for 12 hours right before the test. A fasting sample of blood will be collected and a glucose level will be performed on that sample as a baseline glucose level. The patient then drinks a 75-gram glucose drink. The timing starts on the completion of the drink. Glucose levels are then taken from the patient at various timing intervals depending on the physician's orders. So phlebotomists should use the same type of collection method and same tube type for each sample to reduce variability. And of course, they should remember to put the time and sample, the time that the sample was taken on the tube as well. So some medications can interfere with the oral glucose tolerance test. So these include alcohol, anticonvulsant medications, aspirin, certain birth control and estrogen pills, blood pressure medications, corticosteroids, and diuretics. All right, so this slide gives the requirements for diagnosing diabetes in a patient as deemed by the American Diabetes Association. So to diagnose a patient with diabetes mellitus, they first need a fasting blood glucose level taken. Then they are given a drink with 75 grams of glucose in it. Then 2 hours later, the blood glucose is tested again. And if this blood glucose is over 200 milligrams per deciliter, so normal, just as an FYI, is around 70 to 100 milligrams per deciliter. So if it's over 200 milligrams per deciliter, the patient can be diagnosed with diabetes mellitus. There are 1-step gestational diabetes and 2-step gestational diabetes tests. So for the 1-step, the patient's fasting blood glucose is taken again as a glucose baseline, and they are given a drink that has 75 grams of glucose in it. Then, of course, the glucose levels are measured 1 hour and 2 hours after the completion of the drink. So in this test, if the 1-step test, so if fasting blood glucose is greater than 92 milligrams per deciliter, 1 hour glucose is greater than 180 milligrams per deciliter, and 2-hour glucose is greater than 153 milligrams per deciliter, then the patient has diabetes. So this is a gestational diabetes usually. So for the 2-step gestational diabetes testing, the patient's fasting blood glucose is taken as a baseline, of course. Then the patient is given a drink with 50 grams of glucose in it, and then their glucose is tested at 1 hour after the completion of this drink. So if that glucose level at that 1 hour mark is greater than 140 milligrams per deciliter, then they complete step 2. So this step 2 is performed by giving the patient a drink with 100 grams of glucose in it. And then their blood glucose is tested 3 hours after the completion of that 100-gram glucose drink. So in this two-step test, if at 1 hour their glucose levels are greater than 180 milligrams per deciliter, and at 3 hours their glucose levels are greater than 140 milligrams per deciliter, then they can be diagnosed with diabetes. So lactose is a type of sugar that is present in milk and other dairy foods like ice cream. So the small intestine produces an enzyme called lactase. So this lactase breaks down the lactose into usable sugars called galactose and glucose. So some patients may not have enough of this enzyme to properly break down that lactose into galactose and glucose. So this is called lactose intolerance. So the lactose tolerance test must be a scheduled test, and the patient will fast for 12 hours prior to testing and will have a fasting blood glucose collected as a baseline glucose level. So then the patient is given a dose of lactose to drink. And then after 2 hours, a glucose level is drawn again on this patient and tested. So if they have a proper amount of lactase enzyme, their body will have broken down that lactose given into glucose molecules. So the patient's blood glucose should increase from that baseline blood glucose level. If the glucose levels do not rise more than 20 milligrams per deciliter in that 2-hour period, the patient does not have enough of the lactase enzyme and can be diagnosed with lactose intolerance. Diurnal variation means that blood levels or cell counts will vary by the time of day that they are collected within the patient. So the tests that can be affected by diurnal variation are cortisol, testosterone, estradiol, progesterone, renin, thyroid stimulating hormone, serum iron, and white blood cells. So these levels will fluctuate noticeably throughout the day. If a patient is getting any corticosteroid levels tested, these will need to be collected between 8 a.m. and 10 a.m. or at 1600, which is at 4 p.m. And these, of course, will be timed draws. Some therapeutic drugs must be monitored closely to ensure their levels are in the therapeutic range. And the therapeutic range is the concentration of drug in the body that needs to perform its intended benefit. So a trough level is the lowest concentration of drug in the body and needs to be collected right before the patient's next dose of that drug is given. The peak level is the highest concentration of the drug in the body. The collection time for a peak level depends on the type of specimen. So these will also be time draws and need to be drawn at the appropriate time. This is a list of patient medications that are frequently tested with therapeutic drug monitoring, or TDM. So amikacin, gentamicin, tobramycin, and vancomycin are antibiotics. So these are used to kill off bacterial infections. Dilantin, phenobarbital, and valproic acid are anti-seizure medications. Lithium is used to treat manic depression or bipolar disorder. Methotrexate is a type of chemotherapy drug. Digoxin is a cardiology drug, so it helps with certain heart disorders. And theophylline is what we call a bronchodilator. This helps for lung issues like asthma or COPD. So there should not be any type of bacteria or fungi present in the bloodstream, but sometimes due to a number of reasons, a patient will have a bacteria or a fungus growing in their blood. Bacteremia is when a patient has bacteria present in their bloodstream, and septicemia is when there is actively growing bacteria in the blood, and because of this, the body releases chemicals to help fight that bacteria, and these chemicals cause inflammation, and this can potentially lead to damage of organs. So this is a very, very serious ailment, and a patient will die without treatment. So the laboratory tests for this through something we call blood cultures. So blood culture vials are sterile, meaning they have no bacteria or fungus present in them. And the patient's blood is drawn into these vials, and the vials are put in a special incubator in the lab to help grow any bacteria if present. So because bacteremia and septicemia are life-threatening issues, it's absolutely vital that phlebotomists not contaminate the bottle with skin bacteria, as this will cause a false positive blood culture. So we'll end up growing the bacteria from the skin rather than the bacteria in the bloodstream. So blood cultures may be ordered when a patient has a fever of unknown cause or when their fever spikes. So blood culture orders are stat, meaning they must be collected immediately. And they also must be collected before the patient is giving any antibiotics, because this can cause a false negative, because antibiotics kill bacteria. So the picture on the right-hand side of the slide shows an example of what these blood culture vials may look like. Blood culture orders require that 2 sets of 2 blood culture bottles be collected. So one set consists of an anaerobic bottle and an aerobic bottle. So both of these bottles contain the anticoagulant sodium polyethanol sulfonate, as this does not inhibit the growth of bacteria, but does keep the blood from clotting within the bottle. So I just use the terms anaerobic and aerobic. And so anaerobic bacteria are bacteria that don't require oxygen to grow, or actually cannot grow in the presence of oxygen. Aerobic bacteria like to grow when there is oxygen present. So this is why there are 2 separate bottles in the set. So each set needs to be collected between 30 and 60 minutes apart and in separate draw locations. So usually 1 on each arm. And must be collected before the patient is given any antibiotics to prevent false negatives. So phlebotomists need to follow the policy on which bottle is drawn first with the type of equipment they are using. Now, because bacteremia and septicemia are such life-threatening issues, it's vital that the phlebotomist not contaminate the bottle with skin bacteria, again, because this can cause a false positive blood culture result. So phlebotomists can prevent contamination of blood culture vials by properly preparing the site for a blood culture collection. So there is a 1-step procedure and a 2-step procedure for aseptic preparation of the skin. The 1-step procedure uses chlorhexidine gluconate, which is also called ChloraPrep. This can be used for patients that are allergic to iodine. The ChloraPrep is used to cleanse the patient's skin before their blood is drawn. The tops of the blood culture vials must be cleaned with alcohol and allowed to air dry before they are used for this procedure. Now, the 2-step procedure involves a 1-minute rigorous scrubbing of the patient's skin with isopropyl alcohol. After that step, iodine must be scrubbed on the skin using concentric circles. And so when I'm saying concentric circles, this means that it must be scrubbed starting from the center and worked outwards. Of course, the tops of the blood culture vials must also be cleaned with alcohol and allowed to air dry for this 2-step procedure as well. Now, after the 2-step procedure, the iodine on the patient's skin should be cleaned off with an alcohol wipe to prevent irritation of the skin. Vascular access devices, or VADs, or PICs, or ports, allow repeated and long-term access to the bloodstream for frequent or regular administration of drugs. A general phlebotomist should not collect blood from a vascular access device. Nursing staff collects blood from these, and of course the phlebotomist can help assist the nurse. So the first 5 milliliters of blood collected from the VAD must be discarded. The first 20 mils of blood collected from a VAD cannot be used for coagulation testing, so no PTs, PTTs, fibrinogens, D-dimers, those types of tests that are collected in light blue tops. The correct order of draw for VADs is to discard the first syringe. The second syringe is to be used for blood cultures if indicated. The third syringe is to be used for anticoagulated tubes or for clotted tubes, and coagulation testing should be the very last syringe that is collected. Central venous catheters, or CVCs, are an indwelling device that is inserted into a large central vein in the patient. So these are used for medication administration and for blood collection of critically ill patients. PICC lines, or peripherally inserted central catheters, are CVCs that are placed in the vein in the upper arm. So phlebotomists should never handle these patients and should ask the nursing staff to collect blood from them. Some samples will have special handling requirements that must be followed, or the samples will be rejected and a redraw will be necessary. Cold agglutinins are antibodies that react with patient antigens at cold temperatures. So the test for cold agglutinins requires the specimen to remain warm until the serum or plasma is separated from the red blood cells via centrifugation. So if the sample is allowed to cool before this happens, the antibodies will agglutinate and cause a false negative test. So the tube should be warm before collection, and the sample must be put in a portable heat block for transport to the laboratory. Some analytes, such as bilirubin, beta-carotene, vitamins A, B6, B12, folate, and porphyrins, are sensitive to light and must be protected from the light by being collected in amber tubes or with tinfoil wrapped around the sample tubes. So the tubes on the right-hand side of this slide are amber tubes. So this prevents the sample from being exposed to the light. If you don't have one of these available, the phlebotomist can wrap the regular tube up in that tin foil. Some specimens require them to be transported at cold temperatures. So if that's the case, they can be transported in a transportable ice block. If these are not available to the phlebotomist, they can be put on wet ice. So this is ice mixed with a small amount of water to make a cold slurry. So notice I said on ice, not in ice. So putting a tube directly in the ice can cause the label to come off, resulting in a rejection. So if the patient sample isn't properly labeled, it will be rejected. So a lot of biohazard bags have a pocket on them. So put the ice slurry in the bag and put the properly labeled tube in the pocket. There are specimens whose tests may be used in legal proceedings. So these specimens must have a documented chain of custody form. And a chain of custody form tells who collected and handled the sample, as well as what procedures or testing occurred. So phlebotomists must follow their employer's policy on the handling of chain of custody samples. When performing a legal blood alcohol test, a chain of custody for the sample is required. The phlebotomist should not use alcohol to cleanse the site, as this can cause a false positive alcohol result. The sample must be filled to capacity, and the tube should not be opened prior to testing to prevent evaporation of the alcohol in the sample. An underfilled tube could cause a decrease in the alcohol level present in the sample as well. A gray top tube can be used to preserve the specimen, but what sample tube it goes into is completely dictated by the healthcare facility. Molecular tests can be used to identify DNA for forensic reasons, to diagnose different diseases by detecting the DNA or RNA of a virus or bacteria, or for paternity testing. So there are a lot of special tubes that are used for molecular testing, and the phlebotomist should follow their employer's policy on what tubes or specimens to collect from the patient for these types of tests. Drug screening can be performed for healthcare, employment, and educational reasons. Samples require a chain of custody, and a urine is usually the primary sample for drug screening, although blood can be used. Geriatric or older adult patients may have many factors that make them harder to collect blood from. Some physical factors include bad hearing, poor eyesight, malnutrition, weakness of the muscles, thin skin, and rolling or collapsing veins. There are also diseases that can make it more difficult to collect blood. So examples of this may be patients with Alzheimer's disease, patients that have had strokes, those that have tremors or arthritis. And of course, anxiety and fear can affect anyone at any age. So it's important for phlebotomists to always be kind and to treat patients with respect and dignity. To make it easier to collect blood from geriatric patients, the phlebotomist can use small needles or also butterfly needles, so winged blood collection sets. They should place tourniquets over the patient's clothes or gowns to prevent the bruising of the skin. If the patient is cold, they may need to be warmed up for the phlebotomist to see the veins well enough. Phlebotomists may also need to apply pressure to the puncture site longer on a geriatric patient. Adhesive bandages should be avoided if possible, and dermal puncture can be performed if necessary. When collecting blood from a child, a calm parent might be the key to keeping a child calm. If the child does not have good enough veins, then a dermal puncture may be necessary. Micro collection tubes can be used for infants, and of course heel sticks for newborn babies. Toddlers can be distracted by toys. It's important to explain the procedure to children and to teens, and the phlebotomist should never say that the procedure will not hurt. Unfortunately, sometimes the techniques on the last slide do not work for every patient. So some children are unable to be held or calmed by parents or distracted. In that case, a restraint may be required. Sometimes a topical anesthetic can be used to kind of numb the area, but this is only if it's allowed in the facility's policies. The dorsal part of the hand, which is the back part of the hand, can be used when there is not an adequate vein in the arm. This may allow the phlebotomist to obtain a better sample than a finger stick will allow. Of course, phlebotomists need to follow the procedures and policies of wherever they are working to see whether or not they can use that dorsal hand vein for collection. All right, so this concludes this lecture on special phlebotomy collections. If this lecture helped you at all, go ahead and like it. And also remember to subscribe to my channel for more educational laboratory content.